Which did you like? Did you like the bow tie or the scarf better? I think so. You chose the scarf. Okay. I like the scarf. I think it was a good choice. Happy Friday, Baylor College of Medicine and friends of Baylor. So a lot of people are saying, what are you going to do when the pandemic's over? I wish the pandemic would be over. Doesn't look like it's going away anytime soon. Anyway, if you look at what's going on in the world, you can pretty clearly see the BA1 and now the BA2 peak is coming down, which is a good thing. But if you look at where the hot spots are, it's still Europe, Southeast Asia, Australia, and China, and in particular Hong Kong. Hong Kong is really struggling. And if you look at what countries have had the biggest increase in the last 2 weeks, you can really see it's mostly, you can see it's really China. China's really having a big problem. Hong Kong, they've had so many deaths, they're actually having trouble managing the death rate. And Shanghai is in the middle of the lockdown. And you may have seen on the news, half of the city is locked down and then completely tested, and then they're doing it the second half. Not real happy because the residents are like locked in their homes for 2 to 3 weeks, and there's real issues around, do they have enough food? Now, in theory, if you put people in their homes and they can't get out for enough time when they become non-infectious, that'll work. But as I said before, it's kind of a blunt instrument. And you can see here that China really isn't a huge peak. But to put it in perspective, I just put it against the United States numbers. So you can't even see the peak based on the scale. The United States have so many more cases than China, even their peak, even though it's going up. It's pretty small relative to the rest of the world, particularly the United States, which has way more cases than they do. A real interesting phenomenon. I remember very early in the pandemic, many of us, including me and our friend Peter Hotez and others, were really concerned about the continent of Africa because we knew there'd be problems with vaccinations, and all of us expected to have very high morbidity and mortality. And if you look at it, it's really kind of amazing. This is the vaccination map, and you can see in brown they have the lowest number of vaccinated, less than 20% of the continent. In fact, more like 15%. But if you compare that to death rate, this is deaths per capita, and yellow is very light, means very few deaths. The same exact area that had the least amount of vaccination has the lowest number of deaths, and that has been a real kind of, question in the community. Why is that? What is responsible for that? So the WHO did a study, a big survey, looking at how many Africans have been infected with the virus, and they came up with a number about 65% of the inhabitants of Africa have been infected with SARS-CoV-2, which is about 100 times the number of reported cases. We've all thought, it's probably underreported, but the death rate is not underreported. So the confirmed death toll is around 252,000. Compare that's the entire continent of Africa. Compare that with almost 1 million deaths in the United States. So what is responsible for that? And so a lot of discussions in the literature, but it's thought, Africa's a pretty young continent. 42% of the population is under the age of 15. Just 3% are over the age of 65. And if you look at the conditions that make COVID worse, such as obesity, diabetes, hypertension, those are a lot less common in underdeveloped countries. So you just look at the continent of Africa, 3% are 65 or older versus Hong Kong, where over 45 to 50% are over the age of 65. And you can see the differences in mortality are really a lot based on the age of the population. So very interesting findings with Africa. In Europe, BA2 peak is beginning to come down. All the European countries, France, Germany, Italy, United Kingdom. Of course, Boris Johnson got caught. I don't know if you saw in the news, but he's been fined for partying too much. Party on, Boris, in the middle of the pandemic lockdown that he himself mandated. No partying except for Boris. Anyway, what a nut. So, things are looking interesting in the United States. We were watching some hot spots developing in parts of the country, and it looks like now we're beginning to see the New England area beginning to go up a little. There are parts of Texas, Colorado, and Puerto Rico is having a little bit of resurgence. And if you look at the actual case numbers in New York and the District of Columbia and Puerto Rico, you can see we're beginning to see a slight uptick. Now, it's not like a giant surge, but it's not surprising. We usually follow Europe by 2 or 3 weeks, and I think we're seeing that now. We're beginning to see an uptick. And just as an example, the Gridiron Dinner, which has been off for a couple of years, now is back on. It's where the journalists roast the current administration. It was held in the Renaissance Hotel in the District of Columbia on April 2nd. There were 700 people at the event, 628 guests in the ballroom, and at least 72 were infected. So more than 10% of the people who attended were infected. Now, that's pretty astonishing considering they all had to show proof of vaccination, but they were not required to have a negative test, and no one wore masks. So it shows you that the vaccination against Omicron, while it prevents severe disease, is not as effective at preventing infection, and there was a sort of a super spreader event. And the people who've admitted to being, I don't know why they'd be afraid to, but the people we know were infected: the Commerce Secretary, Attorney General Merrick Garland, the President's sister, Representative Adam Schiff of California was infected, but President Biden, I think, luckily did not attend. But it just shows you, I mean, we're in the middle of that Omicron kind of surge for infections. 2 universities already reinstated their mask mandates: Georgetown University and Johns Hopkins. They've gone back to mask mandates all over the campus, particularly in the medical center. Only time you can't wear your mask is if you're in your personal residence or in your private office. And the reason for that is, you remember spring break? Every year, spring break, huge number of cases. This time they had over 100 undergrads come back from at Hopkins from spring break infected. So, you know, this is, we should have known this. I talked about the CDC wastewater surveillance data. A couple of weeks ago, we were seeing upticks in New England, the Midwest, California, parts of Colorado, and Texas. Well, that usually precedes a surge in cases, when that's exactly what happened. We're beginning to see an uptick in all of those areas now. Texas usually lags behind the East and West Coast by a couple of weeks, and we're still lagging behind. You can see we're doing pretty well. Our friends in Dimmitt County and Harris County, we're actually pretty low. In the Texas Medical Center, we were down to 300 cases, which is really great. And remember, I say all the time, we want to be around 200, but it's getting there. And less than 60 cases were hospitalized per day last week. So all very good. In our own hospitals, we've had just a few people hospitalized. The problem is, when you look at the wastewater data from Houston, 2 weeks ago, we were 18% of the July 6th peak. Last week, we were 25%. This week, we're 38%. And you can see all these arrows means, the increasing amount of virus in the wastewater, which pretty much predicts that within the next week or two, we will see what I've been saying all along will be a surge. Now, hopefully it won't be a giant peak, but it will be a surge. There's no question about it. BA2 has become the dominant strain in the variant in the United States, up to 86%. I mean, really amazing how it's dominated. And I got a couple of questions last week about other variants. Would there be another variant? I said, 100% likelihood? Well, we already got one. So Omicron XE is emerging in the United Kingdom. There have been over 1,000 cases reported. Interestingly enough, we've talked about this before, but it's a recombination event. So every time the virus replicates, every single time there's a cycle of replication, the polymerase makes an error and mutations are formed. Most of them, 99%, are bad for the virus, don't do anything, but every now and then one crops up and becomes the more dominant strain. And each one is related to the other because it's just one mutation at a time. What I've always been concerned about is there'll be recombination between 2 viruses. Now, 2 viruses don't usually end up in a cell. A cell often prevents 2 viruses from getting in, but it can happen. And apparently it had happened. So if you have BA1 and BA2 in the same cell, for whatever reason, patient's not handling the virus well, or just got BA1 and hasn't mounted an immune response and then is exposed to BA2, they can be infected with 2 different viruses, but those viruses can enter the same cell. They exchange domains, exchange parts. And that has happened. So the XE variant is a recombinant between BA1 and BA2. May be a little bit more infectious. We don't know. We'll have to see. There's only been a few thousand cases reported. There are 3 reported in Houston as well. They're more concerning to me are the other 2 recombinant variants, XD and XF. Those are Omicron variants or recombinations with Delta. We don't know what's going to happen with those, but there's an example where you get you could get a more infectious virus that it's also more virulent, cause more disease. We'll just have to see. But this is, I think, the big concern. Recombinant events are much more scary than just the individual mutations. Now, one of the things I wanted to point out, it's really, I've I've talked about longevity. Mankind has had increasing longevity almost in a linear fashion since 1870. We're up to 6 million deaths worldwide, 1 million of those in the United States. And if you look at the impact on longevity, it's pretty significant. For the first time in the last 2 years, we've actually lost lifespan. So the United States has led because we had the most deaths. We've lost almost 2 years of average lifespan, but across the world, lifespan has not increased for the first time because of the number of deaths. The good news is we do have vaccinations, and even though people keep resisting them, vaccines are very effective. There was a really nice study that was published to look at the number of severe illnesses and deaths that were avoided by vaccination. And you can see these would have been the peaks had we not had vaccines, and this is actually what happened. So death toll would have probably been at least 500,000 more people had we not had effective vaccination. And to this day, vaccination is very effective. It remains 10 times less likely that you will die from this disease if you're vaccinated. That's the difference in the death rate. Infection rate is not as different. You know, it's about threefold improvement over unvaccinated folks. And that's why we need, I think, an Omicron-specific vaccine. Unfortunately, we're still being vaccinated to the very first isolate from Wuhan, and that's not, you know, the virus has changed quite a bit. I think the difference in infection rate would be improved had we had a more specific vaccine against the Omicron. Now, that brings us to the fourth dose. You know, the CDC and FDA has approved a fourth dose, a second booster, and recommending it for everybody over 50 based on the data from Israel. I talked about it a couple weeks ago, but the paper came out in the New England Journal last week. And it's really kind of underwhelming. I mean, honestly, they looked at 1.2 million people who were over the age of 60 and compared 4 shots versus 3 shots. And they expressed the number of infections in 100,000 person days. So looking at number of days of avoiding getting infected. And so if you had a fourth dose, you had 1.5 infections per 100,000 person days, compared to 3.9 in the 3-dose group. So yes, it's half as much, but it's not a lot. I mean, it's really just not very impressive. Now, the good news is that particular effect against severe illness is sustained for over 6, 7, 8 weeks. This is the impact on infection, however. 177 per 100,000 dose in the 4-dose, per 100,000 days in the 4-dose regimen. If you only had 2 shots and a booster, the 3-dose regimen, it was 361 per 100,000. So again, about half the amount of infections, but it's 177 versus 361 in 100,000 person days. So yes, it's beneficial, but it's not dramatically beneficial to me. And then that benefit against infection disappears within 4 weeks. So yes, it's helpful to prevent severe illness. It cuts in half your infection rate, but it only lasts about 4 weeks. So that's why I was telling my sister, if you're going to Europe where the infection rates are high, go ahead and get your booster. It doesn't last a long time. So I think, again, more evidence that we're going to need a more specific vaccine against the Omicron variant. One thing, people go, well, what's the point in getting vaccinated? Might as well just get it. I brought this point up a couple of weeks ago, and in the Q&A, long COVID syndrome is a real problem. 2.7% of the United Kingdom population is suffering from long COVID syndrome. We are about to open a long COVID clinic because we have so many patients who have long COVID syndrome. So it's not a minor problem. And fatigue, in half of those patients is the dominant symptom, but people have shortness of breath and loss of smell and muscle aches. So it's better to not be infected. So all those people go, I'll just go with it and get infected. That's not a good idea. So we need better vaccines, longer lasting, ones that are going to be more specific from Omicron, and we need to get everybody who's not vaccinated. So anyway, I want to end this week with a bunch of shout outs. First of all, I want to congratulate 3 of our Baylor faculty members who were recently inducted into the Association of American Physicians, which is a very important honorary society for physician scientists. Dr. Wayne Goodman, who's the chair of psychiatry and behavioral sciences. Dr. Xander Warrens is the director of the Cardiovascular Research Institute, and Dr. Jason Mills is a professor of medicine and co-director of the Digestive Diseases Center. I also want to give a shout out to Rochelle Walensky and the CDC. I mean, they get so much criticism, but I think she got it right. What they did was extend the mask mandate on airplanes until May 3rd. I think if you got rid of the mask mandate, no one would go back. And the problem is, I think we're going to see a surge over the next couple of weeks. And so that was a good decision, no matter what anyone tells you. Way to go, Rochelle. I think that was a good idea. I also want to look forward to alumni weekends coming up next weekend, and I'm really excited about the alumni who are really supporting our student scholarships. So looking forward to seeing all you next week. And finally, I want to wish everybody a happy Easter and a happy Passover this weekend. So have a great weekend, and I can't wait to see you next week.